How's it going, guys? We have a medium difficulty question for risk factors 2CK3. If you're studying for step 1, I'll tell you some very high-yield stuff you need to know for the exam. 61-year-old man, 20-minute episodes, painless loss of vision, left eye that self-resolved, was very alarming. Smoked 1 pack of cigarettes daily, 41 years, BMI 24, blood pressure 150/90, HbA1c 5.5, ECG shows sinus rhythm 80 per minute. What's most likely to reduce future episodes? The correct answer is lisinopril therapy. This is what you need to know. If a patient has a stroke, a TIA, or a retinal artery occlusion, this guy has a retinal artery occlusion, painless loss of vision, amaurosis fugax. There's 2 main etiologies in USMLE. Number 1, atrial fibrillation, where you have a left atrial mural thrombus due to the stasis turbulence in the left atrium that's launched off to the brain/eye. The second is going to be a patient with hypertension who has carotid atherosclerosis. The biggest risk factor for carotid atheroma development is hypertension. I've talked about in my PDFs, my content, how when we talk about diffuse atherosclerosis, coronary arteries, popliteals, abdominal aorta, renal arteries, vertebral arteries, we're looking at diabetes number 1, then smoking, then hypertension in descending order. However, when we talk about the carotids specifically, it's hypertension number 1, and that's because the strong systolic impulse from the heart is going to pound those carotids, causing endothelial damage, allowing for atheromatous development, where a plaque will break off and go to the brain/eye. So in this patient, weight loss would be number 1 if he were above the BMI for overweight, which he's not. Okay, so weight loss is the number 1 way to reduce blood pressure in patients who are overweight. It's more important than smoking cessation. Obviously, they should quit smoking. But for blood pressure, overweight patients, if they lose weight, that's the number 1 way to reduce blood pressure. Now, he's in the normal range. We didn't want to make it confusing where there's more than one potential answer. So USMLE just wants lisinopril therapy. Okay? Now, let's just quickly look at the others. Aspirin therapy is wrong. Now, this patient should be on aspirin. Now, patients who have peripheral artery disease, okay, in their legs, they get intermittent claudication. Patients who have carotid atherosclerosis, they should be on a triad of number 1, antiplatelet therapy. Aspirin is sufficient for USMLE. There's different regimens. Number 2, a statin. And number 3, an ACE inhibitor or an ARB. And USMLE likes lisinopril. So the patient should be on aspirin. But it's not the number 1 way to reduce future episodes because it's the blood pressure that we have to control. Okay, so if we reduce the blood pressure, the patient's chance of a plaque launching off and in the combination with further development of plaques will decrease. Okay, it's what USMLE wants. So let's look at the others. Atorvastatin's wrong. Same as choice A. The patient should be on a statin, absolutely, but it's the hypertension that we need to control. Number 3, low salt diet. It's a throwaway answer choice. You could say, well, if he did that, wouldn't blood pressure go down, right, before we start medication type of thing? I've never seen this as a correct answer in USMLE. Okay, it's obviously something that should be considered. Patients who have a routine where they're eating very salty foods, okay, a lot of soy sauce, a lot of ramen, those types of things, you want to consider their salt intake and their fluid retention, but USMLE is just going to want blood pressure control straight up. Okay, so, and a caveat I want to tell you for 2CK3 is if they go out of their way to tell you the percentage of occlusion on carotid duplex ultrasound, which would be the next best step to diagnose the etiology here, if it's under 70% symptomatic, 80% asymptomatic, they just want the triad of therapy here. So the answer could be lisinopril, the answer could be statin, the answer could be an aspirin therapy. They want the patient on all 3 medications under those thresholds. If we gave you the same vignette here and we told you there's 90% occlusion on carotid duplex ultrasound, and they list endarterectomy and lisinopril as 2 separate answers, endarterectomy is correct. It's annoying, it's a caveat, but I'm telling you because here the answer is lisinopril. We're not specifying degree of occlusion. But if we said he's got 50% occlusion, he's under the endarterectomy thresholds, the answer is going to be aspirin, statin, lisinopril. If he's over, the answer is going to be endarterectomy. Smoking cessation, obviously very important, decreases MI risk in patients perioperatively especially. Decreased atherosclerosis, risk of cancers. It's a very broad, correct answer on USMLE, but the high yield point you need to know for this clip is that when we talk about stroke risk, stroke, TIA, retinal artery occlusion, hypertension control, blood pressure management is more important than smoking cessation for USMLE. Smoking cessation, wrong fucking answer.